So hello everyone and welcome to the case 37 of this case discussion series, and today we'll be discussing a pediatric case. So here we have a 3-year-old child with progressive and symmetric lower limb weakness, spasticity and hyperreflexia. An MRI brain was ordered for this patient, and these are the axial T2 weighted images of the MRI brain done for this patient, where we can see that there is increased signal anterior to the frontal horns of bilateral lateral ventricles on T2 weighted images, axial section. These are the corresponding flare images, where again we can appreciate this hyper intensity anterior to the frontal horns of the lateral ventricles. These cone shaped hyper intense signal which is seen anterior to the frontal horns. These are the corresponding T1 weighted images, where we can see that the same area shows hypo intense signal on T1 weighted images. Corresponding hypo intense signal on T1 weighted images. Sagittal images are not there in this video. The sagittal images look like this. There was gross thinning of the corpus callosum, particularly anteriorly. On these sagittal T2 weighted images, it is very well seen that there is thinning of corpus callosum. So this is the report that I had given. Cone shaped high signal intensity extending a short distance from the anterior horns of the lateral ventricles appreciated on axial T2 and flare images, with corresponding low signal on T1. This is very important that the signal showed the corresponding low signal on T1 weighted images, giving a typical ear of lynx. Lynx is an animal, Canadian animal, and its ear resembles this cone shaped hyper intense signal. So hence giving a typical ear of lynx appearance. There was diffuse thinning of the corpus callosum as well, which was very well seen on the sagittal images, particularly anteriorly, without any abnormal signal, focal or diffuse signal intensity change within the corpus callosum was seen. The findings were suggestive of hereditary spastic paraplegia in this particular case, considering the clinical history. So other than hereditary spastic paraplegia, this ear of lynx sign can also be seen in Markia-Fava Bignami disease, which is actually a CNS disorder seen in chronic alcoholism, which causes necrosis and demyelination of corpus callosum. Differential that has to be remembered in this context is ependymitis granularis, which is actually an anatomical variant. This is also also presents as an increased signal anterior to the frontal horns of the lateral ventricles, but this is very small and is less than 1 centimeter. It's not very prominent, and the very important thing is it does not show any corresponding low signal intensity on T1 weighted images.